Kristen, my presentation, do sleep disturbances cause anxiety and depression, or vice versa? According to the Centers for the Disease Control, adults need 7 hours or more of sleep per night for the best health and well-being. A third of U.S. adults report that they do not get enough sleep. Not getting the right amount of sleep can cause chronic diseases and conditions such as diabetes, heart disease, obesity, and depression. A brief overview is the topic I chose in week 1 was health. Evidence shows that if you have a healthy lifestyle, your mind can function better. A healthy lifestyle would include eating a balanced diet, exercising regularly, drinking alcohol in moderation, maintain a healthy weight, and most importantly, get enough sleep. But what if you have disturbed sleep habits? Can anxiety and depression be controlled with sleep? Some scholars will argue a symptom of anxiety and depression is sleep disruption. But what if it's the opposite? What if you could stop a person's sleep disruptions who is struggling with anxiety, depression, or both? Would the mental struggles go away? Did you know that anxiety affects 40 million adults in the United States? And for the sake of time and the many different types of depression, I will not go into specific depression statistics, but believe me, they are high. To help me dig a little deeper, I've recruited 2 brilliant doctors. My first expert is Dr. William Copeland, who is currently working at the Department of Psychiatry and Behavioral Sciences at Duke University. Dr. Copeland is an expert on depressive disorders, generalized anxiety disorders, and separation anxiety. His focus is on sleep disturbances and the effects it has on psychopathology early in life. He has written several research articles and has been a professor for over 25 years. My second expert is Dr. Rachel Roberts, who is a clinical psychologist. Dr. Roberts has been practicing psychology for 15 years, and her focus is on anxiety and depression. She is an associate professor whose research interests are clinical health and neuropsychology. She has been a part of many research studies which use qualitative, quantitative, and meta-analysis. Dr. Copeland shares research which shows evidence that adolescents with sleep problems are more likely to have a mental disorder such as anxiety and depression later on in life. This research suggests that if sleep problems were corrected in younger years, a mental diagnosis could be avoided. Dr. Roberts explains that this study revealed that sleep disturbances are a symptom of anxiety and/or depression. Evidence also shows that sleep disturbances can lead to alcohol and drug abuse, suicidal tendencies, and neuropsychological impairment. The relationship between anxiety, depression, and sleep disturbances are clear. I think we can all agree that sleep disturbance is a substantial problem. What would be helpful to know does sleep disturbances cause a person to have anxiety and/or depression, or is sleep disturbances a result of having anxiety and/or depression? Dr. Copeland's theory of fixing a person's sleep issues at an early age is a hopeful and proactive theory and one that should be further researched. Dr. Roberts' research, although insightful, is giving readers symptoms but unfortunately no solutions. I hope that someday soon that more people who suffer from anxiety and depression can find ways to negatively affect a person's life. Thank you for listening, and I hope you all have a good night's sleep.